It's a true honor to welcome Dr. Suresh H. Advani, a pioneer in Indian oncology and a name synonymous with courage, resilience, and medical excellence. Padma Bhushan and Padma Shri awardee, Dr. Advani is celebrated as the first oncology to successfully conduct bone marrow transplant. Over the decades, his groundbreaking work in hematology and medical oncology has given hope to countless lives. Despite personal challenges, including overcoming polio at a young age, Dr. Advani's unwavering spirit and dedication to his patients have made him a symbol of inspiration both in outside and the medical community. Today, we are privileged to hear from a legend whose life story and medical journey continue to transform cancer care in India and beyond. Dr. Advani's story is one of the personal resilience and national impact. He has served at Tata Memorial Center, helped establish the DM in medical oncologist. His legacy includes launching cutting-edge treatments like PART therapy and playing vital role in shaping India's cancer policy and care model. Dr. Advani, it's our privilege to host you today. Welcome. Dr. Advani, for a newly diagnosed cancer patient, how do you plan the treatments, whether it is a surgery or chemotherapy, radiation, targeted therapy? What do you suggest?
Type of the treatment which is to be given, whether it is surgery, radiation, or medical treatment in the form of chemotherapy, immunotherapy, target therapy, all that is decided, one, depending upon the stage of the disease. Second, the type of the pathology, which makes a big impact on the treatment decision. And thirdly, what type of the disease it is. Like if it is a leukemia, similarly, in some of the conditions like lymphoma, it's only the chemotherapy, target therapy, immunotherapy, that means medical treatment, plus minus. So you can see that all these treatments are not applied in every patient of cancer. They are to be selective in terms of what is its use and also how it is going to cure. Lastly, I must mention that all these treatment sequence is not decided just by the thinking about in that particular disease, and should know that whatever the results, if we say in some of the breast cancer, we give first chemotherapy, then do the surgery. Or there are groups who will give first surgery and then chemotherapy, which is a better result than data is there. So based on that data, we decide what. So I think it's the treatment decision requires a thought process. It's a computer has the sort of a brain that you need to ultimately decide. And that's where I think in future AI is going to be very useful. The knowledge and science is expanding so fast that we may not be able to keep up, but AI can help us. So I think that's where we have our brain, but we need another brain like AI to compensate.
Oh, that's wonderful. Today, Dr. Advani is informing us that AI also will help us treat the patients in a better manner and choose the treatment plan depending upon their previous experiences. The legendary himself is talking about AI, and we are very proud of it today, being Indians. Doctor, many patients are going a lot of side effects while taking chemotherapy, and they're always fearful to go for the next cycle. So how do they overcome? What is your say on it?
Yeah, I think basically in the field of immunotherapy, which is based on killing the tumor cell. It kills not only the tumor cell, but it kills also the normal cells. And that's where all the side effects are. Of course, the new generation of treatment, like immunotherapy, does not kill the normal cells. So they have no side effects.
Okay.
We only target the tumor tissue. So they have no side effects.
Okay.
But chemotherapy has the side effects. And people have a lot of old memories by which they feel they have a fear that they will get the side effects. In olden days, I must say, there was a lot of nausea, vomiting, and the weakness. All these things used to be much more. Today, the drugs have improved. They are much more targeted sort of thing. And also the fact that we have very good, what we call it, pre-medication system. Which means I'll make sure that I give pre-medication in a way that he will get no nausea, no vomiting. So today, we can confidently tell our patient, you will have no nausea, no vomiting. We will be eating all the way as we have been eating up till now. The side effects are minimized. Second thing is, like we have a side effect of hair loss. That is still persists, but they always come back and they go. So they need not worry about it. Third thing is about the weakness. Some people do feel weak after getting out of it. But again, strong, they are eating well. The weakness is not felt much. It is very thin, very good. Agile, more less in terms of weakness. And therefore, we realize all these things and give the patient more nutrition, including the IV nutrition, to make them strong rather than go into the weakness. So basically, I think in today's world, the side effects are absolutely minimized. And even the patient of 85-year-old or without much.
Oh, wonderful. Doctor, when do you recommend radiation therapy, and how has precision technology improvised the outcome?
Yeah, I think radiation therapy is a very important part of our total therapy. Particularly, it has a local area control. So if the patient has got head and neck cancer or lung cancer, esophagus cancer, we quite often use the radiotherapy to take care of the local disease, maybe the primary. And nowadays, the radiotherapy, the olden radiotherapy, used to be broad radiotherapy to affect the surrounding normal tissue. But today, the radiotherapy which has developed is more precise, what we call it conformal radiotherapy. It only radiates to the tumor tissue without touching the any other tissue. So the side effects have become much less, and it is much more effective because you can give the adequate dose without bothering about the side effects, which have been developed. What nowadays we call it linear accelerator, we call it digital radiotherapy, we call it proton radiotherapy. All these are terms which have been used to really make the radiotherapy more and more precise.
Doctor, how do genetic tests and biomarkers help in personalizing cancer treatment plan?
Yeah, I think all of us have realized now that why does the cancer occurs because the normal cells get transformed into the cancer cells due to some gene. Tobacco, when you chew it for a long time, the cells in the mouth, the DNA gets mutated. And when it's mutated, it produces the tumors. So this is what is the important thing. So like that, in many cancers, we have now realized the presence of this gene mutation. And the main thing which is there, which has really sort of helped us, is in the lung cancer. Lung cancer, we have identified at least about 100 of mutation and gene mutation.
Doctor, how do you approach palliative care for advanced stage cancer patients, and how important is quality of life in treatment decision?
I think in the field of cancer, where we are treating the patient, and patients do respond, some people may not respond. But all throughout the treatment, we always focus our attention not only to the effectiveness of the drug, but also the quality of life. And quality of life today has become a very important part of evaluation. Palliative care is usually for the patients at that stage. Our aim is to maintain the patient's quality of life, to maintain the patient's general health, to maintain the patient's free from the pain. So that's the aim at that stage. Because obviously, when we are exhausted or all the treatment, the patient disease can progress and ultimately can lead to the end of the life. But during this period, patient has to be looked. And as an oncologist, we never give up a patient. patient is our friend till he lives. And that's the way we work. So we always continue to guide the patient, continue to look after him, that he receives the adequate nutrition, adequate hydration to live nicely, and also to make sure that he does not suffer from all the problems of the terminal case. So I think the palliative care has become a very integral part of the treatment, particularly in India, the majority of the patients are diagnosed in their advanced stages, and many of them ultimately cannot be controlled. The disease cannot be controlled with the treatment, and that's the time the palliative care becomes an important area.
Thank you, Dr. Advani, for your wonderful time. It has been more than a conversation. It's been a lesson in dedication, vision, and compassion. Your legacy is etched not only in awards and papers, but in every patient whose life you have touched. And to our audience, let's not fear cancer. Let's face it, understand it, and let's treat it together. If you wish to reach out to Dr. Advani from wherever you are, we can always help you to have an online consultation with him. Do connect with us right away. Thank you.